reasons one of the doctors at Petsadena might recommend X-ray for your pet would include looking at the chest, the lungs, the heart, looking at the belly to look for any foreign material that your pet might have ate, especially if they're throwing up, checking for any fluid buildup in the belly or the chest, or even for masses or growths in the belly. Most of us, when we think of X-rays, think about just looking at bones, although that is one of the reasons we use X-ray. We actually use it for many other reasons in animals, as you can see. So today we'll cover how we take the X-rays, what your pet is going to experience when they're taking an X-ray, and then the images we pull up after we take an X-ray. A question we get frequently asked as veterinarians who recommend an X-ray is my pet safe? Is it okay to take X-rays on my pet? And what are the side effects or risks? There are not many risks involved with taking X-rays on a pet. When it comes to exposure of the pet to radiation, the exposure is minimal, given that we only take a few X-rays during a pet's lifetime. Obviously, we want to lower the risk as much as possible, which is why we try to localize where we have pain or discomfort or where we want X-ray to make sure that we are only taking X-rays of the portions of the animal that we think are going to be helpful in helping us diagnose our condition. For people, the case is a little bit different. If we are actually taking X-rays on the pet, we have to protect ourselves because people having repeated exposure to X-rays has been proven to potentially put them at higher risk for developing cancer. So one of the things we do is we will put on an X-ray gown, and typically we will also have a thyroid shield that will cover our neck area. We also will wear lead-lined glasses to protect our eyes from the X-ray beams, and we'll wear gloves on our hands to protect ourselves from the beam as well. When we are taking an X-ray, the highest concentration of X-rays are going to come from directly under the beam. But there will be scatter where X-rays will kind of fly out to other areas around the center of the beam, and that's why we need to be protected. So when we are taking X-rays of your pet, one of the positions that we take, depending on the location we're trying to image, like say the belly or the chest, is this position. This is where we put them on their back, and we have a little cushion foam that will keep them kind of snug in their position. This usually will require two people, where one person will be holding the back end and one will be holding the front end. Our little patient here, Axel, is actually behaving very well to let me hold her by myself, but we do need to remove ourselves from the X-ray beam and make sure we focus the beam where we want to take the X-ray. And so removing ourselves from the beam does require two people to be able to do that. But as you can see, typically most animals will be comfortable and allow for us to take the images that we need. In some cases, depending on the level of discomfort, pain, or the positioning of the pet, we may actually need to sedate the pet to make them more comfortable and allow us to be able to take the images that we need. But for the most part, it is not a painful process, and we just have to kind of walk them through being comfortable with allowing us to handle them. Once we have our patient positioned for the X-ray, we typically will, by the push of a button, be able to take the images. Usually we'll take at least 2 to 3 images to give us a good idea of the structure we're trying to look at. Once we take the X-ray image will pop up on our computer screen here. The whole process of taking X-rays takes about 30 to 60 minutes from start to finish, and we typically get results immediately. So your doctor can review the results and then go over them with you and tailor your pet's treatment plan based on those results. And that's as easy as it is to get X-rays at Petsadena.